Sure, we're recording. Wonderful. There we are. We good. Hello, everyone. I would also want to go ahead and get the slides up. Are they being shared? Oh, they are. Let me see if I can see them then. There we go. All right. Um, whoops. I am so excited actually to be talking to you about this topic because I'm here talking with a group of people about system change. And one of the things that I find when we are doing this work is that we often misunderstand that some of the things that are happening with people is trauma related. And where I come from in this work, if we can go ahead and go to the first slide, is that we need to take time to explore what helps people and communities to heal. We're not just about eradicating or trying to eliminate symptoms. It's important that there are strategies that we implement to create communities of healing. And that as we are doing this work, we're paying attention to that. Okay, so it looks like some people might be struggling to see the slides. I'm not sure. Is everybody else able to see the slides? I see the slides, but I'm not sure. All right. If we can help, if you can send a message to Khadijah and see if they can help you, we'll make sure. And then we'll also send the slides afterwards. So today I'm going to try very quickly to go over a few strategies for what we can be doing to implement healing-centered approaches. We'll also have an opportunity to do a quick breakout. And I just wanted to make one other quick thing about who we are. So I'm the CEO of Both In Partners, and a number of my team members are here. So I don't know if they added their name and said Both in their name tag, but that might be great so that everybody here knows that you're part of my team. And that we focus on three things that are really, really important. We want people to be grounded in your purpose. And one of the things that we try to do with that is we use an appreciative approach in helping you get grounded in your purpose. That means that we focus on the things that help, what are true, what's good, and what's possible. We also work with people in actually changing their day-to-day practices that would be aligned in the direction of the things that help. And then we will look at policies, resources, and data with an eye for what is possible instead of just looking at the things that are like counting widgets. And I find that this is a much more effective way to create sustainability and to help reduce burnout. So I want you to know that overall, that's what we're talking about. And that one of the ways that we can do this is to talk about being healing centered. So we like to start off by getting an idea of who all has joined us today. So we're going to do our poll. Go to this slide, the next slide, and show the poll. Is the poll up? There we are. So the first few questions here, are you getting our newsletter? And have you had a chance to participate in our equity cohort? If you have not, we are literally starting this week, and there's still time to join. We also have a cohort. People are already signing up for October, so we want to make sure you know that as well. And of course, are you excited to be here? So can everyone see the slide, see the poll? All right, thank you. So let's someone on my team, let me know if people are starting to answer the poll because I can't see if it's being completed. Oh, I guess I get to do this too.
Yes. We have some people completing it. So we have about half of our participants are excited about signing up for our newsletter. Half of them have not participated in the cohort, and everyone's excited to be here.
Uh, I love that. All right, let's um launch our second poll.
There we go.
So on this, I wanted to know, have you taken the ACEs assessment? Um, has anybody here read The Body Keeps the Score or read My Grandmother's Hands by Roz McKinnon? So these are a couple of resources that I think are really important and useful as we are talking about being trauma informed and healing centered, and what I'd also like to offer as being trauma responsive. And if you are not familiar with these resources, we wanted to start off by giving you some very good resources to use in your journey and being more healing centered. So what are our results so far?
So we have 50%. Yes, I have taken. About 50% no, I have not taken for the first questions. For have you read The Body Keeps Score? 23% yes, 70% no. And then for the last one, have you read My Grandmother's Hand? 94% no and 6% yes. So if you read it, we want to know the four people that have read.
So these are obviously some good resources that maybe you haven't been familiar with. I would highly recommend as resources. And I'm going to have a number of others as well as we continue in our conversation today. So early on, or as we move through this, I would love for you to add in chat so my team can be tracking what is it you are hoping to learn today. Yes, that's so good. So quickly in chat, what are you hoping to learn? Um, and then also, let's go to the next slide. Okay, yeah. How do you do centered healing? Great. What else do you want to learn? So team, if you all could be checking that, I'm going to just go through a couple things that I think are important in terms of why we're even talking about this topic. So according to SAMHSA, everybody, I think it's important first to just say trauma is widespread, right? It is harmful and it's costly. So as we are trying to be more aware, I think we need to recognize that. It occurs as a result of violence, abuse, neglect, loss, disaster, war, and other emotionally harmful experiences. I don't know about you, but we're still coming through COVID. Trauma has no boundaries, right, with regard to age, gender, socioeconomic status, race, ethnicity, geography, sexual orientation, abilities, right? All of these things that there is really no movement with that. And in this last statement, and I'm reading this out because I just think it's important that we highlight that it is almost universal experience of people with mental and substance use disorders. So when we think about, especially myself, I'm trained as a clinical psychologist. Trauma is generally at the root of most everything that we're dealing with. And I recently just watched a couple episodes of couples therapy. I think trauma is involved like all throughout. Like that's what you see, right? Like that's at the root of these things. what I want you to know is that there are things that we can do. Okay, we're going to go to the next slide. So in addition to whether or not it's mental health, gender, other things, we know that people of color, especially Black Americans, experience discrimination and stress as it relates to their culture. So back in 2020, there was this acknowledgement that two in three Black adults, that's 65%, cite discrimination as a significant source of stress in their life, compared to 55% adults back in May. So this is just something we need to be aware of, and I think it continues to be present. More than 3 in 5 Black adults agree that their race is difficult in today's society. We'll go to the next slide. Most of us have heard of PTSD. Um, when we think about our youth who are, at risk, so we want to pay attention to the ways in which PTSD is understood and actually be able to go beyond sort of the traditional definitions of PTSD and understand issues around persistent racial trauma as well. So one of the things that we're starting to notice, right, is that trauma can be passed through your genes and has an impact when children are in their mother's bellies before they're even born. And so we want to be mindful that these are very important aspects of both how trauma happens and then what we can start to do about that, because there's also ways in which we can heal when we understand these things. We'll go to the next slide. I think it's important that in addition to understanding gender discrimination, race discrimination, that ableism also discriminates language access, deaf and hard of hearing. So there can be additional stressors when you're not even sure that the provider you're going to is going to be able to understand or meet your needs. So when we think about disability-related stress, I think it's important that we are acknowledging that and the trauma that adds on top of everything else that's going on. And just the anticipation, right, that there's going to be some difficulties related to how they'll be treated. So as we are doing all of this, I just wanted to first establish that we know trauma, discrimination, persistent racial trauma, toxic environments are part of what we're dealing with right now. We'll go to the next slide. So what can help? And I think in the chat, what I was noticing is sort of a question around like, how do we move from one to the other? What are some of the other, Tony, any of my Tonys, anything you noticed in the chat about what people were hoping to learn today? Anything y'all are noticing?
I mean, just so this is Tony. A better understanding on centered healing, coping skills, how to deal with trauma in the workplace, more language around the difference between trauma responsive and healing centered. And Jessica wrote, I'm relatively new to healing centered engagement and want to learn more.
Awesome.
And then the last one is, how do you transition beyond trauma informed care? Okay. And I've also heard trauma reducing care, and I love that.
Okay. So I wanted to model that you need to ask people what they're interested in. One of the things that helps is actually asking people a different set of questions. So trauma-informed care, which is actually very progressive, helped us stop asking or saying what's wrong with you and start asking the question of what has happened to you. What we also know about trauma and work and being healing centered is that we do absolutely need to address people's basic needs. We also need to start understanding that many people from a trauma perspective are going to be thinking about power over because that's been their experience. It's been about compliance. It's been about someone controlling them. And so part of what we can do to be helpful as providers is to focus on power to and power with, and we can focus on community. So before I get into some content, I wanted to at least share a really quick story about how I really started to understand this in a very personal way. I worked with a gentleman, his name was Dorian Parker, and he started a program called African American Men in Recovery. And when I was a postdoc, I was asked as part of a group to go find out why this program was being so successful in supporting Black men in their community. They had lost all of their funding. Where the room they met in did not have tiles in the ceiling, and they were having 30 and 50 men show up twice a week supporting each other in their recovery journey. They also were located in a clinic that was literally across the street from the local crack house. One of the things that we learned as we went and talked with the men is that what they said that a lot of things that made a difference. So one of the things I wanted to highlight is that they said it was important that they were getting well in their community and not outside of their community, and that their wellness was helping their community be part and support their families. So when we think about community, when we think about trauma, this is not just about working individually, it is also about community. And I wanted to share that piece of it because if we are only focused on individuals and not also on communities, we're really missing a huge component, and we're not building on the resilience that is already there in that community. We'll go to the next slide. So how many people, put a 1 if you have heard of Maslow's hierarchy of need in the chat? All right, most of us have heard of this, right? How many people knew that he got this Maslow's hierarchy of need by studying and learning about the Blackfoot Nation? Put a 2 if that's new information for you. Okay. Excellent. So we can send you this article, but I think it's really important that one of the things that we talk about with Maslow's hierarchy of need, right, is that we have to have those basic needs met. And then you can move up, through the whole process. One of the things that we're acknowledging now by going back to what he originally studied is how important community is, right? How important the context of having being seen as a full person, and actually just assuming that you have what you need as a person to begin with, and that what we need to do is wrap into you. So I wanted to start off by just first acknowledging that being healing centered is actually something we've known for a really long time. This is like not really new. And that it's important that we are building on the resources and thinking about community actualization and not just individuals in that process, okay? We'll go to the next slide. So when we are talking about trauma-informed versus healing-centered, what we are doing is that we are learning how to ask some different questions. So trauma-informed, which is asks a very helpful question, which is what has happened to you? Also, though, the implementation of trauma-informed care has tended to focus on an episode of harm, an injury to a person, so not necessarily to the community. It has been mostly focused on clinical and individual approaches. And there's sort of a treatment mindset. When we are moving toward being healing-centered, we're going to ask the question, what's right with you? So a key story here that aligns with the peer recovery movement is that we want people, and for you to go in talking to people in communities and saying you are more than the worst thing that's ever happened to you, right? So the focus here is being more holistic on healing. We want to recognize that it's in the interpersonal relationships that people have, and institutions have a role in what they're going to actually do to support someone's wellness. We need to take in consideration the environment and the environmental context that people are in. And we want to make sure that you as providers are doing things to sustain your own health and wellness. So one of the first things that you can do is to find ways for yourself to be centered, for yourself to be well, and for you to have a strong understanding of your own personal identity. We'll go to the next slide. So Dr. Sean Ginwright, who also is the author of The Four Pivots, and if you've been getting our newsletter, you will know that we have been recommending The Four Pivots for the last year and a half or so. This article is one of the first that I found that helps us talk about the future of healing, right? And how important it is for our youth. So Dr. Sean Ginwright helped coin and start what is called healing-centered engagement. We'll go to the next slide. And I want to encourage anyone here who is interested in becoming more healing-centered to do this healing-centered certification. I got certified a couple years ago. And what you will learn about are the principles of karma. So I'm going to go over them really quickly today. But I think it's important that you know that this is just the beginning and that you can encourage other people to do the certification. It is online, it is self-paced, it may be focused just on youth, but I find that it is very inspiring for anybody in all of the work that we do. One of my favorite things about karma and the work here that we get from being healing centered is that it understands that we also have to talk about issues of politics, that we have to talk about the things that are real, that are happening to people. So the breakdown of karma is to focus on culture. So I think we pretty much understand what culture might be in the various aspects of that. But that should go beyond just race, right? We can talk about the culture of recovery. We can talk about gender as a culture. I mean, all the different language issues, we need to be just mindful of that. There's also a focus on agency, relationships, helping people have meaning and purpose. And then my favorite, which really aligns with the kind of work that we do and being taking a both and approach, is understanding that we have to help people think beyond, what they think is realistic. We actually have to talk about our aspirations. We'll go to the next slide. So here are some strategies of what you can do to be more healing centered. One, when you work with someone, you want to expand their personal narrative. And a strategy to do that is to acknowledge that what they feel is real, find ways to be curious. If you've been with me before, that means you need to ask why 5 times, okay? We need to practice validating what people share, ask and center for them, what do they want to see us do next? All right, these are just very practical questions. As an individual, I want you to explore your own racial and intersectional identity and be able to talk about it, be able to use your own story to connect with other people. And I want you to be aware of the interpersonal, the internalized and systemic issues of racism, prejudice, and perceptions that can happen. So if you are a provider, you need to be able to understand how someone might be responding to you. One of the things that I recognize is being Dr. Hawkins brings a certain level of, some people see that suspect in the community. They're like, I mean, I've had this happen, did you really earn your degree within our own community, our own internalized oppression, right? As also, there can be spaces in which that is seen as a positive. So these are things that I have to be aware of when I'm working with people. We need to have and embrace more body-based approaches when we're doing work with people. So it's not always about medication. We think about trauma. We want to be able to encourage like yoga and movement and art and dancing and poetry in our work. So just, different approaches that are not just about therapy. Next one. And for you, we need to find ways to be non-anxious. All right, I would love in chat If you find that you typically are very anxious, put a 1. If you would say that you're pretty calm, put a 2. All right, so we have a mixed, oh, someone did a 1.5. Oh my goodness, okay. So yeah, it can depend, all of the different things. So what can we do? One, we can practice breathing, right? It is really underappreciated how helpful just learning how to take a deep breath is, which is actually what we're going to do right now. All right. So everybody, we're going to take a deep breath in and you're going to let it out. I want you to take another deep breath in and let it out. We'll do one more deep breath in and let it out. Box breathing, just taking a moment. Thank you for that. If you are doing talks, put a pause into your work so that everybody takes a breath. Also a tip. So some additional strategies. I want you to take time to get to know yourself, get to know strategies that work for you, get to know strategies that work for other people, and find a community that you can be real in. I'm looking for anybody who understands what I'm saying about that. Like, yes, I know we need communities to be real. Sometimes you need a space that is safe enough where you can say, I'm not having a really good day, so that you could go and show up for other people. And we need to make sure we do that. Okay, last couple things, and you're getting ready to go into a breakout in just a little bit. And what I want to find out from you is from what I'm sharing, do you want to try and do? Okay. So healing centered history. How many people here have heard of the book Chasing the Scream by Johann Hari? Put a 1 if you have heard of the book Chasing the Scream. Put a 2 if you've never heard of it. All right. I'm giving y'all lots of resources. So Chasing the Scream is a really helpful book to understand our so-called war on drugs and the history behind that, which is also the history behind our mental health and trauma and ACEs, actually. So yeah, your book list might be growing. I would recommend every book that Johann Hari has written at this point, because I just think it's so important that we are hearing, and I think he's a really good writer. We need to be able to tell our history honestly. And we need to understand how our systems have gotten to be like they are. When we think about behavioral health or mental health, substance use, housing, being unhoused, right? Trauma is at the base of all of these things. And so we need to be able to be not just aware, but able to not just informed. We need to ask those questions of like, what else would help someone, right? We need to be in a position where we're helping people have autonomy, where when we're working with individuals, we're helping them have the ability to uh, be active. So that could be activism, that might be voting, and that foster agency. So when I think about agency, this is the ability and the awareness and the sense of like, I actually can have an impact. We'll go to the next slide. So last couple pieces here, important aspects of this work is really centering on hope. And I thought this is a great piece to know in positive psychology, that when we think about hope, there's actually 3 components to hope. There's a goal part, right? There's having a pathway, being able to find a direction to achieve your goals. And then there is, again, this word agency, which is believing that you can actually have an impact. I wanted to pull this apart because in my experience, it's hard to do any of this work without hope. It's hard to get up and not have a sense that you can do something, that you have a focus, that tomorrow can be, or today can be a little bit better. And so part of our work is to find ways to cultivate that. And I don't know that we always do that when we talk about trauma. We'll go to the next slide first, because trauma can, in your brain sort of make you think that you can't do anything. So your work ahead, I want to encourage you to, one, get all the books we've mentioned, but also to learn and become part of our community where you're able to implement an appreciative approach to help reduce burnout, to help people have the confidence to be able to be responsive, and to create spaces in which we are helping people not burn out. We'll go to the next slide. So to start off with, you need to start with yourself as we think about the communities. You need to have a way of understanding your own identity. We want to practice being culturally humble. And I haven't mentioned this before, but we need to be able to hold space for other people's defensiveness, anger, and guilt. Okay. When you know yourself, then you're going to be able to be in that space. Some of the ways that you can do that is to start to pay attention to, how do you notice the current or historical racism, and listen without being defensive or deflecting when a person is sharing, right? Are you making an effort to think about how does your privilege show up in your day-to-day? One of my favorite things with working with communities and community engagement is that sometimes we set up meetings and we expect everybody has money to go to lunch. And sometimes in a community meeting, that's not true for everybody. So we should be aware of that. Yes, we'll also share slides. We need to be aware of tone policing, right? About how we understand how someone can raise a question. And my favorite, what I hear this, favorite, which I'll say is like not really a great thing, is how people will say, well, we have to be professional. Well, what does that mean? And in what context? Is that more dominant culture? And then the last thing I want you to reflect on is, well, what is respectful communication? Because there's all different kinds of ways, and we need to be able to have dialogue about what some of these things are. Yeah. We will go to the next slide. So I try to make sure you have time to connect. I know, and we're still right on it. We're going to invite you to a breakout room. And the question here is, what do you want to start doing differently? Just pick one thing. Tony's getting you into some breakout rooms, hopefully about how many people are in a room? 3? Okay. So we're going to give you 6 minutes and then we'll be back.